Is your sound working, I hope?
Mataroria.
Just loading. All right, ready when you are.
Kia ora matua.
Tēnā koe Mataroria.
Live, Panya.
Tēnā koe Boyd.
Yeah.
Nā koe matua, pihana.
Ka pai.
Thanks for joining us. Are we live? Are we, Panya?
Yeah.
Okay. All right, we're live. Tēnā tātou. Tēnā tātou. Tuatahi rā ka timata ki tukakia. Nō reira ke inoa tātou. Kia tau miho ngā tauwhurotanga mi ngā raupitanga o te wāhinga roki rungi a tātou. Ko tātou no te mātātahi, te humania e pīkoko ana ki Ngāti Kanga o te ao Māori. He ara hina tātou I roto I tō tātou nei whai, kia whai te ara tika, I te ara pono, kia eke panuku, eke tangaroa haumi e hui e, tā ki e. Nei te mihatu kia koutou, kia ku nui, kia ku rahi, a kua whai wāhi nei ki tēnei o ngā kaupapa hei kōrerotanga mā tātou. Ko tēnei mea te rongoā, e pāna ki te vaccine, e pāna ki te COVID-19. Nō reira nei te mihatu kia koutou katoa, aha koko wai, aha ko no hea, nau piki mai, nau kake mai, ki tēnei o ngā tūmomo whare kōrero. Nō reira nei te mihatu kia koutou katoa. Tēnā koutou. Good evening, everyone. I'd just like to introduce two of our two guest speakers for tonight, and we're very privileged to have them on with us tonight, and that's Dr. Anthony Jordan and Dr. Mataroria Lyndon. If I'll just get you both to introduce yourselves one at a time. Mataroria, you can start, and then I'll lay down what's going to happen for the rest of the recording.
Ka pai, te mea tuatai ka tukumiha tu tēnei kia koutou katoa, e matakitaki maina, koe hoki te tuakana Boyd, tēnā koe mō tō karakia I te timatanga o tātou nei huihuinga. Me tō tāua nei taha ki Ngāti Whātua hoki. Tēnā koe e te matua Rex hoki, pai ki te a koe anō te pōnei, anō reira kei te mihi. Tōku whanaunga no Ngāti Wai hoki, Anthony, tēnā koe me tō tāua nei taha ki Ngāti Wai. Ko Mataroria tōku ingoa, he uria hau no Ngāti Hine, Ngāti Whātua, Ngāti Wai, Ngāti Kahu, me Waikato hoki. He rata hau ki mahitahi haora ki Te Tai Tokerau, ara o te rā ki Ten Healthcare, he whare haumaru ki Tāmaki Makaurau, he kaiako hoki ki te whare wānanga o Tāmaki Makaurau, nō reira tēnā koutou. Kia ora tātou.
Tēnā koe Boyd, tēnā koutou katoa everyone, ko Ngāti Wai o te iwi, ko Kawa te marae, ko Anthony Jordan tōku ingoa.
Kia ora rā. Tēnā kaurua, o te rā tēnā tātou anō. So I thought we'd just provide an opportunity tonight to, this was originally just to be for our marae forum and our Ngāti Whātua iwi forum, but we might have some more visitors and manuhiri on, both online and within the Zoom as well. So welcome you all to that. Just want to get some of the common questions that are being asked, and just to get both of you your feedback on some of those questions, and just to remind everyone that You're both doctors. Anthony Jordan is an immunologist, and Mataroria is one of our superstar doctors from the north. And really appreciate you making time and your expertise to this kaupapa. So it's just real simple. It's just a chat, really. Sorry, and my name's Boyd, and I'm the General Manager for Te Oranga, which is the health for Te Runanga o Ngāti Whātua health. Well, it's not about Te Oranga. So I'm from Te Oranga, General Manager of Te Oranga, and I'm from Hokianga Whirinaki. Grew up there, so welcome everybody. Okay, I think I will. I'll just ask the questions, and you can decide who gets to answer them if you like, or I can.
You can give Anthony the hard ones.
I'll give Anthony the hard ones. First question, though, that's really common, and you've probably had it amongst your daily working lives, Anthony, is it safe, and what are the side effects?
Yes, it's safe, and I think the thing we don't communicate well is that safety. It's going to sound like an airline video almost, but your safety is our primary priority, and that extends beyond just the safety of the vaccine, but also the safety in terms of protecting you against COVID-19. I think one of the things that we're privileged here in Aotearoa is that we haven't seen the ravages of this disease like we're seeing around the world. And that can sort of not give us the right context about why we're so keen to protect everyone through vaccination. And vaccination is something that's been with us for a very, very long time. You know, it's one of the treatments that we've used for centuries now. And a lot of the diseases that we no longer see, and I always talk about things like smallpox, polio, diphtheria, diseases that people will have heard of have been eradicated by using vaccination. So this is not a new concept. It's a well-established concept. I think the speed with which this vaccine has been developed sometimes puts that out of context. That it can't be safe if you can make it this quick, but it can be. And actually, the vaccine that we are rolling out here in New Zealand is an mRNA vaccine, which is a new type of technology in terms of in the public forum, but actually we've been working with this technology for decades now. So that just reminds us that this isn't something completely new. The side effects of it are similar to most other vaccinations, to be honest. So it's not uncommon to get aches in your muscle, and where they injected you, that's really common. And sometimes you can get a fever for the next 24, 48 hours and feel a bit achy. That for us is a reassuring thing as immunologists, because that's what we like to see. We don't like you to experience it, but it tells us that your immune system is recognizing what's in the vaccine and producing the protection that will stop you getting sick from the disease if you're exposed to it in the future.
Mataroria, anything that you wanted to add?
Tautoko ngā kōrero o Anthony, ai he ngā pātai nui, hea ngā painga, ngā hua, hea ngā āwangawanga hoki. What are the benefits, but also what are the concerns or the risks? And like Anthony said, it is safe, it is effective, and it will save lives. It's not only effective at protecting yourself around catching COVID, but also that protection or kaitiaki of your whānau and of our korea and kaumātua as well. So not only individually, but also for our whānau and for our communities as well, that it can both help reduce the risk of contracting or catching COVID, but also there's emerging evidence of reducing risk of passing it on if you do catch it. But importantly, in how the vaccines were designed, is that it's particularly effective at preventing getting really sick from COVID. So not ending up in hospital and not dying. And that's what the original studies showed. It was that 95% effective at reducing the risk of having symptoms of COVID. And nobody in those studies ended up in hospital or dying from COVID. So that's why we know that it's really effective. And we also know from the studies since they've been conducted, but also this vaccine's been rolled out internationally across hundreds of millions of people, that it is also safe. As Anthony said, you do have some side effects. I've had the vaccine myself because I really believe in it, and it's important to be able to get vaccinated. I was lucky to be vaccinated as a kaimahi hauora, a health worker. And so I've had my first one, and I had a bit of a muscle ache, very, very small, but I was back to mahi the next day and also back to the gym as well. I didn't feel ngenge, I didn't have a headache. I was pretty good to go, actually. And so I've had the first one, and I'm due to get my next one next week. So I've seen the rangaho, the research, the studies, and also the number of people that are having it both here, which is over 15,000 now among the border workers and the health workers, but also overseas where other countries have also been having the vaccine rolled out too. So not only is it safe, effective, but it's also looking after yourself, your whānau, and particularly our Korean kaumātua who are at greater risk of the impacts of COVID. Kia ora.
Kia ora. I think you all just heard also, whānau, if you get the vaccine, you can go to the gym. Another good side effect.
Anthony.
Another one of the common questions, and it's probably two rolled into one, is can those who have many comorbidities and those who have compromised immunity, is the vaccine safe for them and our kaumātua? So three cohorts in that question: kaumātua, comorbidities, and those who have compromised immunity. Start with Mataroria.
Kia koe, Anthony, get the phone.
I said, me again.
I thought we're going
the simple answer is yes. You know, what we know about this vaccine is that those people who need it most are the people you've just described. And the vaccine is safe in those people. The side effect profile isn't increased, but the risk of getting really sick if you contract COVID is higher in those people you've just described. So that's why we've prioritized them as the group that we want to vaccinate, and vaccinate, as we've talked about, all those people around them to ensure that that sort of extension of protection extends to the whole whānau, the whole community. Because there will be some people out there who may not get the vaccine right away. They may wait, or they have a reason why they can't get it initially. And those people have to be protected as well. And that's why we've prioritized their families and their workplaces as well as part of our vaccine rollout.
And just to add in tautoko, the vaccine rollout is happening at the moment, as you may have seen across Tāmaki and Te Tai Tokerau. Starting with the border workers first, ngā kaimahi ki ngā wakarererangi, and then moving on into the kaimahi hold of the health workers. And that's happening at the moment through March into April, as well as starting off in Te Tonga o Tāmaki in South Auckland, as well, before moving into our Korea and our kaumātua, those in aged care, and that'll happen also before then moving across for everybody living in Aotearoa from July onwards. So that's part of the priority of vaccinating those who can be most impacted from COVID, and then in different groups or rōpū, rolling it out at different times over the coming year.
Thank you. So Mataroria jumped the queue earlier, eh?
Also, I thought you jumped the gun with answering the next part-time.
No, that was on there too. That was definitely on there about the transmission. So you've answered that. But there was another question, just in particular to the vaccine, and it is it was just added here on, but I thought I'd add it now. Is well, maybe. Do you think that this vaccine, with the different logistics that it has around having to be stored in a deep freeze, having 72, I know that there's changing profiles on it all the time, but having a 72-hour shelf life after that, and then having to be injected into somebody's arm after within 2 hours of being drawn, do you think that it would have been wiser to wait for a vaccine that didn't have those limitations and could be treated as our normal vaccines, we were able to deliver them. So this one can't travel once it's been drawn. And so just to see if there's any opportunity, or what would you have preferred? But I also know there's some safety concerns with the other one. So I'll just start with you this time, Mataroria, and don't pass the baton.
I could pass back to you, Boyd, as part of your mahi at Ngāti Whātua. Kia ora, Margaret, for your pātai. I think it's good that we've got one to roll out. So I don't think we can necessarily look at, oh, what could we have? I know that we've got some other possibilities in future, like the Johnson & Johnson one. The government secured different vaccines depending on which one we could get first. And the Pfizer one is effective, as we've talked about. It's got some logistical challenges around having to keep it at a cold temperature. But at the same time, I'm glad that we have one that we're able to roll out now. Now, in terms of having other options that would be good to have, for example, the Johnson & Johnson one that's been used internationally, and also that we might secure in future, you only need the 1 dose, not the 2. And you also don't need to have that deep freezer to keep it stored. So it'll be logistically easier to be able to have, particularly out in communities, thinking of the far north Te Tai Tokerau rural areas, where you need to be able to have vaccines out there. We'll still do that with the Pfizer one, but it would just make it easier if we've got a few options so that we can make sure that we've got as much coverage as possible.
Dr. Jordan, anything to add?
Yeah. I would just say when we chose the vaccine that we wanted, we went for the best one. You know, the logistics of things are always hard. I understand that, but if it's the best one and it's the one we're going for, as always, we need to overcome the difficulties of it. And I would just say the exact same thing as what Mataroria said, is that if there are logistical problems, they're not going to be logistical problems that go away. We're going to have to address this at some point. You know, this may become the vaccine technology that we need, especially if we need updated vaccines for coronavirus in the future. And this technology is something that I suspect we will see much more commonplace. So it's better that we come up with the infrastructure around it and make sure that we can roll it out no matter where we are across Aotearoa. We have to come to terms with that. This is the new standard. And so instead of accepting something that may be easier to do, if this is the best thing to do, then we should just come to terms with that.
And part of the planning is with Ngāti Whātua and other Māori health providers as well, is about making sure that we do have good coverage, where we have the access available for whānau across Tāmaki and Te Tai Tokerau. And so that's up to us as a health service to be able to overcome those logistical challenges and make sure that we're able to provide that access. So having different clinics, having different vaccination centres across the north is part of our planning at the moment, because not everybody lives close to town. And so that's why we need to be able to have our different Māori providers and other health services being able to go out to whānau rather than the other way around.
And I think that'll be a spin-off of this whole process. We will see how we can deliver healthcare better, although it may be logistically hard going through this process. So this will be a really invaluable learning process for us that work in healthcare to say, wow, we were able to do this and we got what we needed. So I think out of this will come a lot of learning for us.
Absolutely. We're all being forced to grow and review how we do our practices. So absolutely agree.
Yep. And we saw that during the COVID testing throughout the past year, where we had to stand up new ways of doing things, including having the different pop-up for COVID testing centres across Tāmaki and Te Tai Tokerau, and the important role that Māori and Pacifica providers in Tāmaki, for example, played in order to be able to protect our whānau and our community. So that those were the new ways of working, not new for Māori or Pacifica providers, but very much bringing new ways of being able to engage, increase access and look after whānau during the lockdowns.
Awesome. There's bit of a simple, well, not simple, I guess, but I wanted to know if either one of you could answer. There's about 4 questions in this, and I'll remind you if you need reminding during it, the answer. It's how does it work? Is it injecting COVID-19 into your body? And what is in it? What is mRNA? And does the vaccine change our DNA? Which change our whakapapa? That's some of the questions that have been quite common. I will throw this to Dr. Jordan.
Damn it.
The immunologist.
So mRNA is kind of like a temporary recipe. It's what we use in our bodies to make proteins already. So this is something that is already in our body. What we're doing here is through the vaccine is providing a little recipe for your body to produce part of the spike protein that allows your own immune system to build immunity. So your own cells learn it, and like all things, they forget it after a while, but the immune system learns what to do next time it's presented to it. So this mRNA is something we already have in our body in terms of our process. We're providing it with some temporary instructions. Those instructions get quickly cleared out of our bodies, but our immune system learns from it. The important thing about mRNA is it can't go back into your DNA. So it can't write your DNA. It's kind of the script that it takes off your DNA. It can't do it the other way around. So that's an important thing, because people that hear about it think, oh, DNA, RNA, they sound similar. There could be crossover there, but they're actually quite different. And that's why we have RNA, to prevent rewriting of our DNA. And there were 2 other questions that.
What's in it? What's it? Does the vaccine? No, I think you pretty much answered. How does it work? You've already explained that. Injecting it into our body. What's in it? What is mRNA? And does the vaccine change our DNA or our whakapapa? Mataroria, did you have anything to?
I think that's why Anthony's the immunologist. He's
excellent.
Down pat.
Yeah, I was going to say that too.
I practiced it in the mirror this morning.
Good work. Good work. Will this vaccine cover mutating strains of COVID-19 that we've all seen coming out, or will the one that we're getting now, will we have to get a new one? I'll throw this to you, Mataroria. Reading.
Yeah. So the Pfizer vaccine, which we have in studies of, for example, different strains, the South African variant, the UK variant, it's already shown to still be effective. So that's a good thing, you know. But at the same time, I know it is able to be updated as it continues to be rolled out. So a bit like with the flu vaccine, sometimes it's adjusted each year depending on the flu season, and so it wouldn't be surprising to me if the recipe of the vaccine in terms of the different strains that it covers is updated as well. But the current one that we do have is still effective against the various strains that we've seen overseas.
Awesome. Anything to add, Anthony?
No, and I would just say that this is the benefit of an mRNA vaccine, is that you can update it relatively easy from a vaccine production point of view. So just like influenza vaccines, these may be altered and updated to give that really high level of protection.
Awesome. I was going to give exactly the same answers you both gave. I'm glad you did it so I didn't have to.
Oh, you can do the next one.
There's another one, and I know this might seem like a strange one, but I just thought I'd ask both of you, just to make sure that I'm absolutely correct. There are rumors that you get a barcode once vaccinated. Is this true? And I've said no, and we've had our staff members go through, but just to confirm from clever doctors, because I don't have doctor in front of my name, no one gets barcoded?
No, so what I did come out with after my vaccine was a vaccine card, and it tells me the date of my next dose, my second dose, but there's no barcode that you're given. There's nothing that's implanted that's a barcode or anything as part of the vaccination process either. So there is no barcode, but just a reminder card, which is very helpful. So next week I know when I need to go.
Thank you, Dr. Lyndon. There's a couple of other questions that have been thrown at yourself and me last week, but I just thought I'd throw them in here again. What would you say to whānau who think that we should just build up our natural immune systems, good nutrition, exercise and sunlight? Start with Anthony.
It doesn't necessarily protect you from bad outcomes for COVID-19 is what I would say. Those are all fantastic things for being healthy, and they're great things and you should do them anyway. But when we're thinking about specific interventions for COVID-19, we know people who are otherwise well doing everything else can still have severe outcomes. So this is an added layer of protection on top of that. We shouldn't think about it as an or, we should think about it as an and. You know, we want you to do those things, and we also want you to have the COVID-19 vaccine so we can maximize your protection.
Mataroria,
it is a and in terms of haora and looking after yourself. Kia tika ngā kai, kia kurikuri tō tinana, kia pai tō moe hoki. So that and of supporting your haora and your immune system by doing the right things, like Anthony said, as well as having the vaccine. And I'll also add what we've learned over the last year as well in terms of looking after yourself, in terms of good hand hygiene, using the Tracer app, still important. All those other things that we've done, wearing a mask when you're on public transport, those are still important too, and those are part in addition to the vaccine rollout rather than an or replacing it. It's all of the above. It's all of those things that are really still important.
And I think that will be a really important thing once we roll this vaccine out, is all of those other things we just talked about are still going to be a critical part about protecting ourselves and protecting our whānau, our wider community, because a lot of behaviours may change, and that's, I guess, what we don't want to do is we don't want to see people stop doing everything else, because those other things have been really important in protecting us, and we want those to continue on. At some point, the border will open, and people will come from countries that have high rates of COVID. And that will include people returning home potentially with COVID, and we still need to make sure that we can contact trace those people. We know where we've been, we can protect ourselves through all of those other mechanisms we've been using up till now.
And just to add that along with the vaccine helping yourself and protecting you from COVID, but also in your whānau and koe and kaumātua, those who are more at risk of COVID. It's also about preventing future lockdowns. I think in future, we have to come back to some level of normalcy, not only in terms of moving in and out of alert levels, but also being able to have contact with whānau overseas. I've got whānau in Australia. You know, they haven't been able to come back. And similarly, friends and whānau here who have had mokopuna and they can't travel. And so part of what I think of the vaccine as a chance, as part of all the other tools we've just talked about, is about being able to look after not only yourself, but also being able to have those chances again of being able to return and having people come in back into Aotearoa as well.
I think also you forgot to mention, Mataroria, that once you have your vaccine, everyone can go to the gym. That'll contribute to our health and well-being. There was another question, and it was just around people who don't believe that COVID-19 itself is as deadly as we think it is. Mataroria, you had this question last week, and that we think we might be overreacting. Do you have a response and some words to share for people who think that it might not be as dangerous as we think it is?
Yeah, I'll start, and I know Anthony's got a lot of whakaaro on this too. and we know that it's both the chance of getting really sick from it, but also higher chance of death as well. And we've found after people have had COVID, there's now long COVID, which means some people, they are still having symptoms after they've cleared the illness. So new research I've just seen today around neurological symptoms. Others have experienced loss of smell since having COVID. So I just say that there's not only the risk of once you contract COVID or get COVID, but also the symptoms that remain for some people. And research out of Aotearoa has also shown, particularly for Māori and Pacifica, greater risk of hospitalisation and death from COVID. And that's for different reasons, not only in terms of chronic health conditions among our whānau, but also all the other issues around getting access to healthcare, where we know that currently Māori can't get services when they need to, and it's not as good for many of those services aren't as good for Māori compared to non-Māori. So those are all the reasons why we're at greater risk, and hence why it can have greater impact for us too. So that's just some of my whakaaro about the level of risk, and that, you know, it is real. It's real risk. To me, it's real. And why it's important around doing all the things that we've talked about tonight, but also getting vaccinated. And that's why I got vaccinated too.
Yeah, Anthony, I think you spoke about it earlier. It's hard for us to put it into context because we haven't had the same level of COVID rates and deaths. You got anything to add as well?
Yeah, I would just add that a lot of the data is easily available in these times where people skew data that they're presenting to say, oh, it's no worse than the common cold. But that is just factually incorrect, actually. And people go looking for data that supports their own position. And one of our roles is to look at all of the data and say, actually, what is the truth about this? And the problem is the risk for any single individual changes based on who you are, how old you are, the diseases that you have, and that alters your risk of getting sick and potentially dying from COVID-19. So there isn't a one size fits all, and that gives that really broad sort of death rate that people hear about being down around 0.5% through to actually over 20%. And I think people really need to remember that the stories that we hear are influenced by the storytellers who are telling it. So everyone has a motivation about why they want you to think it's just like the common cold, but it's not.
Yeah, that's a tricky question, isn't it? But because we haven't had the context of overseas, and people aren't seeing our hospitals choked up and our Māori not being treated because of it. So thank you for that. There was a question that kind of goes with a question from Marty Rogers. And there's one question around, will the vaccine be compulsory? And from Marty, she's asking, as a provider, should I consider an acceptable risk for the people I serve versus the numbers of staff who vaccinate? And I think that's where that compulsory question comes in, because some of our workforce are worried that if they decide not to vaccinate, this is the health workforce I'm speaking of, that if they decide not to vaccinate, that they might lose their job. I might have a crack at first answering this, and then I'll let the experts give a better answer. But for my end, and from, I guess, from all the conversations and what we've done over the last year, currently we're using those safe hygiene practices, those cough and sneeze etiquette, there's washing your hands, staying home when you're sick, wearing a mask. And I think if my staff choose not to vaccinate, and if they're in front-facing communities, the safe distancing, if they're in the front-facing positions where they work with our communities, we just encourage our whānau and our staff to continue those safe hygiene practices. There's no change whether they vaccinate themselves or not for me. But I'll get some expert answers we'll start with Mataroria.
Now, pai te pātai, and I think it's a good pātai. What happens after vaccination, and what about those who don't choose to vaccinate? It isn't compulsory, and And that's an important thing to note. You might change your mind. And I know Boyd talked about this last week on Te Hiku, where some people choose not to, and then they choose to, or they're still thinking about it. And, having kōrero like this tonight is all part of having information out there for whānau to understand more and understand and have that choice, which I think is an important choice and recommendation from me to be vaccinated. And in terms of your pātai about kaimahi, we're already seeing instances overseas, but also locally too, particularly for rest home aged care residents and companies here in Aotearoa, thinking about, particularly because rest home residents with the elderly koe kaumātua at some of the greatest risk of death from COVID, like we've seen overseas, and they're starting to think now, for those who already have a job, that's different, but for those who want to come and get a job with them, there's that thinking about needing to be vaccinated. That doesn't apply to existing because they've already got the job, but for future employment, I just saw in the news a kōrero about that. And so I think it's both acknowledging Boyd's point around making sure there's the good precaution and practices in place, but also I think it might be about, depending on who you're working with, and having some frontline kaimahi, particularly with our most vulnerable, and and if they're vaccinated, they're out there. Doesn't mean the others still can't work, but they might be doing different things or looking at doing it in a different way with whānau who aren't as vulnerable. I think that's one way that I'd look at it, about what are the different duties that could be done, and if there's greater risk for example, rest home residents in care, I'd prefer that it's the vaccinated person who's directly working with those most vulnerable, acknowledging that the others who haven't been vaccinated still have mahi there as well. It just might be different. I think it's evolving. I know it's a national kōrero, it's an international kōrero, and I think at the likes of the Ministry of Health level, there'll be some guidance that comes out, because I think, like yourself, Boyd, you're thinking about it, this pātai from Māori is a good one. Different companies in Aotearoa, private ones including, like the aged residential care, they're all thinking about it too. So it's a good question, and I think a bridge that we need to cross with some good advice and policy guidance for us all.
Anthony?
As a general rule, making anything compulsory is one way to turn people off pretty instantaneously. So as a principle, I don't agree with it. And, I'm very, very pro people being vaccinated for their own individual protection and the protection of others. And like you've both said, we need to look at the most appropriate duties for those people who may not necessarily choose or are able to be vaccinated. And there's pretty strict criteria around what you're allowed to do to employees, and forcibly vaccinating them is not one of them.
There was a question around why is it not available for our tamariki under 16 years of age, given that we're trying to achieve, herd vaccination, herd immunity, and that under 16 makes up a large percentage of our national population. Will we be able to achieve herd immunity without vaccinating those of our tamariki under the age of 16? Anthony, I'll start with you.
Yeah, I'll throw another one for Anthony too. On that note, it was a pātai came through from Te Raroa about pregnancy as well.
Oh.
So I'll start with the studies for both pregnancy and children under the age of 16 are ongoing. There is always a concern that is, although pregnant women are much more vulnerable to bad outcomes from COVID, we know that. This has to be a careful discussion with people who are pregnant about what is their risk, and remembering pregnancy ends at some point. So those people who are pregnant now may not necessarily be pregnant in 3 months, 6 months time. So this is one of those situations that we're in an enviable position at the moment, that we have time to say the COVID vaccine is able to be given to those pregnant women who are at high risk, those who are working in healthcare facilities, MIQs, for example. It's not a reason not to give it to them, but also we have very low rates of COVID in the community at the moment. So we don't need to rush out and do it. So most of the international guidance at the moment is expert opinion, and RANZCOG, who is the group here in New Zealand, have been really clear that this should be a conversation, but we also need to provide our lead maternity carers with the evidence and just say it's not a safety concern that we're saying that people can't have it, but it's a careful conversation that people need to have with pregnant women. Tamariki are a little bit different, that we have to wait for that evidence. And I think the difficulty is there's a lot of bad false press on vaccination for tamariki, and so people are always worried about, I want to know more than just what you've done in 6 months. I want to know what the data is at 1 year, 2 years, 3 years, 4 years, 5 years, and that makes it a little bit more difficult.
Mataroria?
Just in terms of tamariki, the original studies didn't have children in them under 16, and hence why we've started with adults or tai tamariki older than 16, and that those studies are underway now, because like you say, Boyd, in order to get what we call herd immunity, to reduce the risk of transmission, we need all of the population to be vaccinated, but we've started with over 16s first. Secondly would be about, for those school-age children, it's a really interesting example overseas around closing schools during lockdowns, and the question around how widely children transmit COVID versus adults. So adults transmit COVID a lot more than children do. Children still do, but adults do more so. And hence, not starting with children, not only because the original studies hadn't been done on children, but also the second kōrero or thinking is also about the increasing evidence around how much children would transmit COVID or at risk of COVID. We've started off with those most at risk, which are adults, particularly those with chronic illnesses or koe and kaumātua, prioritise them first. And then once we've got more studies, we can then look at rolling out the vaccine for children as well, because we know that we need to get the population coverage in order to get herd immunity, which is basically about once you've got a high number of people who are vaccinated, it means that there's no longer any chain of transmission between different people. So the virus can't get in, harder to get in and harder to transmit.
That in turn protects those of us that can't or don't vaccinate, right?
Right.
Excellent.
Our hope would be, though, that all the over 16-year-olds get vaccinated to protect pregnant women and tamariki, because that's a much better effective way of achieving herd immunity while we wait for that evidence. So we just flip it around and say, oh, can the rest of you do it, please?
Absolutely, absolutely. We've actually kind of dried up on questions. So
there was one more from Margaret. One more from Margaret, and this one will be for you, Boyd. We might turn the tables and review Pātai from your perspective around the challenges around the rollout, and are the timeframes realistic? You know, we've said we want to do from July, everybody, basically, and the question from Margaret was about, are those realistic timeframes, and is the plan realistic, and what are some of those challenges around the rollout?
Thanks for that question, Mataroria.
It was from Margaret.
And Margaret, I know you probably messaged her. Yeah, that's a good question. And to be honest, right now, given the position that I'm in and the challenges that I'm experiencing, I would say that that timeline is a good guide, and that in order to achieve the number of vaccinations that we want to achieve in the timeframes that have been outlined by the government, there needs to be some serious investment in training and staffing, in equipping and resourcing our services with the best equipment, with the best technology. We need to have an effective booking service. We need to have an effective line of communication from kaitaia through to Auckland, where the vaccine will be stored in the freezer. We need to have effective chains of delivery. There's a whole lot of work that needs to go in. But I'm going to say that if we achieve all of that and we staff and resource and train and IT ourselves up really well, we can get bloody close. We can get bloody close to those timeframes. But the main thing as well around those timeframes is the different groups that have been verbalized and spoken of by the ministry. I wanted to add that for Māori, where they've said 65 and over. I wanted to add that for us. We're considering that our Māori, due to the health life experience of our whānau, that our 50-plus-year-olds fit into that category of they have the same urgency as those whānau that are 65 plus for non-Māori. So that's why we're hoping to get it done a lot sooner. We've been very fortunate so far in that the government has achieved things ahead of schedule, but I think they put long deadlines ahead in order to make themselves look good, to achieve it a bit earlier. I'd do the same thing. I do it with my assignments. So I think we can meet it, but there needs to be a lot of resourcing, a lot of training, a lot of upskilling, a lot of staffing, a lot of IT. There's a whole lot of stuff that needs to be done, but I really do think there's a real wish and drive to achieve it. And I think that we, with those goodwill that we have, there needs to be some high trust from the government, some high trust from the district health boards with our Māori providers, and because they've seen that we can react and we can serve our people well when we have high trust, when we are resourced, and when we are trained and skilled. And so I think we can meet it. I think we might start slower than we had planned, but I think we will build up momentum with those things. Is that the last question you've got, Mataroria?
Ask Margaret. There was a couple more parts that came through on
I've seen that. I've seen one.
But no, tautoko your kōrero, Boyd.
Yeah, can I also add that we should never waste a space or a dose? You know, if someone turns up and they're willing to be vaccinated, we may never get another opportunity to encounter that person and give them a really good experience of the system we've designed. So I completely agree that actually this needs to be a prioritization, but there needs to be flexibility to say, this is the time that that person came to see me. I'm going to intervene. I'm going to use my clinical expertise here and say, this is the opportunity to vaccinate a person that's willing. If you turn someone away, you may never get that chance again. And I say it all the time to the government. The prioritization matrix is a good starting space, but don't you ever tell a provider to turn someone away who wants to be vaccinated. That's just counterintuitive.
Yeah, no, we've had that same discussion amongst all the Māori providers, in Te Tai Tokerau at least. Yeah. Absolutely, we're not going to turn anyone away, but we need to be able to have the flexibility to do that. I see that last question. This is a good one for Mataroria. On average, how long do you think this vaccine will provide immunity for? Is there some research about that? And will some have to be vaccinated and those compromised?
And those compromised. So the first point, we know from the study so far that it's 4 to 6 months of immunity after the vaccine. But we also know from other vaccines that have already been existing for other illnesses too, that the immunity from those vaccines lasts much longer. So that's part of the kōrero. And your second part was about the those compromised, like immune compromised.
Yeah.
Will we have to be revaccinated? It just depends. I think depending on the different types of variants or strains that are happening, it might well be where there might be booster vaccines in the future. Booster, what I mean by that is that just like with other vaccines, sometimes you have to have another one in a few years' time. I know I still get, there was a recent, vaccine catch-ups for some of the other illnesses too. So that might be possible. But at the moment, we've got the existing vaccine that's still covering those different variants that we have, that we need to cover for at the moment. I know Anthony's got a lot to say on this part too.
The one thing that's really hard is that we don't have a blood test that tells us you're protected. For so many other vaccines, hepatitis B, tetanus, all of those vaccines that we're experienced with. If your blood test says no, you need to be revaccinated. And that's the other work that we're doing behind the scenes, is coming up with a threshold through a test to say, yes, you're protected, so that we can check it to ensure that you've got ongoing protection. And that's really important, because all of those people that may or may not be protected would be able to check if they are, and that will determine potentially what it looks like in terms of needing to revaccinate people. So that's definitely a work in progress.
Oh, that's excellent. I didn't know that. Thank you. Yeah, we've actually got no more questions. I've got nothing more come through to me. Do you have, I have been asked this when I've been on panels, but do you have any last words you'd like to share, Mataroria? You've had the most time off.
I've got I was going to say there's one more partai that's, I don't know which Facebook you're looking at, Boyd.
Oh.
What's in the vaccine, like the ingredients? And I'll start by answering my own question. There's sugars, salts, fats, and the active ingredient is the RNA that Anthony messaged, had a kōrero about. Anthony, is there ingredients? The partai was about what's in the vaccine. A good practical question.
So the main thing to be aware of is it contains something called polyethylene glycol, which sounds dangerous, but it's not, don't worry. And the mRNA is very easily degraded. So it's surrounded in this sort of fat coating so that it can get into the cells and not be destroyed before it gets into the cells. So in addition to what Mataroria has already said, that's probably the thing that's different about an mRNA vaccine, is it's sort of encased within this sort of fatty coating to protect it.
Got any more questions to ask yourself, Mataroria?
Ka hore. And I'm mindful, Boyd, you probably got dinner on the table soon. That's all right. There was a ngā mihi, not a partai, not another partai. They probably want to go too. But in terms of, last words, I think I can summarize that the three things around the vaccination rollout is around having enough of the doses, having those distribution channels out to the community, and also the demand for the vaccine. So are people actually going to take it? And part of tonight's kaupapa was about having the kōrero, asking partai, answering partai, so that people have the communication that's coming through different channels, and it's coming from kaimahi holder like ourselves, but it's also understandable and meaningful too. I think that's part of what needs to happen for the rollout. And just lastly is about, to me, this isn't about a vaccine, this is about our holder, this is about kaitiaki and whanaungatanga, and looking after those who can't get vaccinated, who aren't able to. And so that's just what I want to talk about, hauora, whanaungatanga, whakapapa. And if you're coming, I know for our mahi with Māori health providers, just like with COVID last year, was dial 1 for a kaipak, dial 2 for a COVID test. It's about the wraparound and the service that we can provide for whānau who might be in need. Yes, we want to get the vaccine, but we also want to make sure that we're able to provide the tautoko during this time so that we can respond and recover from COVID. Kia ora tātou.
Anthony, did you have anything else you wanted to add?
No, I think we've covered a lot tonight. Forums like this and actually discussions that we're having are probably one of the most persuasive ways of convincing people to have the COVID-19 vaccination. We know with other vaccination programs, Mataroria and I help to give you the information, but the conversations that you have once you leave here with those people that you discuss at work, at the dinner table, those are incredibly powerful discussions. So be very proud that once you've heard this stuff, that you hold such valuable information that you can pass on that can help protect other people.
Awesome. I just want to me to kia kaurua for freeing yourselves up tonight. I really appreciate that. I know Mataroria took time out from the gym. So I really want to thank you, Mataroria and Anthony, for doing it. And it was really quick notice too. So I really do appreciate, and I agree, I think these conversations are really important to ensure that our whānau, whatever questions they have, can be answered respectfully, because I think there's a heap of questions that are going unanswered because they're not being answered respectfully. And so hopefully anyone that's had a listen, and this will go online, I'm pretty sure our clever staff will add name tags down the bottom so we know who's speaking, etc. But I really want to thank you both for freeing yourselves up. I really want to thank everyone that tuned in either by Zoom or on the Facebook, the YouTube, or if you're watching it as a recording. So nei te mihatu kia tātou, katoa. I'll close us off with a little kakia so the Mataroria can go to his gym.
Ngā mihi ki a koe Boyd, mō tō kai whakahaere, hei kai whakahaere mō te kaupapa te pōnei. Thank you for organising, taking time out of your time, but also mihi te Ngāti Whātua, Oranga, and to the Hauora for putting this on tonight. Kia ora.
Ka pai.
Tēnā tātou. Nō reira kia ino tātou. Turunga tū, turunga tapu, te mauri tū, te mauri tapu, te mauri te whiwhia, te mauri te rawea, nō hia te mauri, nōrunga, nōrangi, nō nuku tū. Ko tēnei te mauri ka whakapiki, ko tēnei te mauri ka whakakake. Te mauri o ngā tupua, te mauri o ngā atua, te mauri e tau ai ki runga i a tātou katoa. Puta no i te rohe. Te mauri o te tai au kia puta ki te whai au, ki te ao mārama hau i e hui e, tā ki e. Puatarau.
Haere. Kia ora.